Hello everyone, my name is Allison and today I'm going to be performing a nutrition-focused physical exam on my patient over here. So the first thing you need to do when doing these exams is just introducing yourself to the patient and kind of explaining what's going to be happening. So, hello, I'm Allison.
Hello.
Nice. How are you doing?
I'm fine. How are you?
Good. So I'm the dietetic intern and today I'm going to be completing a nutrition-focused physical exam on you. So I'll be kind of looking at different parts of your body, feeling around to look for any nutrient deficiencies. Is that okay with you?
Yes.
All right, so we can go ahead and get started. So now that we have consent, you will have the go to start the exam. So the first thing that you need to do is kind of start with the general survey. The general survey can give you some helpful background information on the patient that can help the exam go a little smoother. So you can ask questions like, have you had any unintentional weight loss in the past 6 months?
No.
All right. And you can also take note of the patient's consciousness and ask questions like, what is your name?
Carol.
Carol. And then where are we right now?
At my appointment.
At your appointment, okay. And then you can also take note if the patient has any shakiness or rigidness. So the first thing that I'm going to start with in this exam is examining the patient's hair. So when looking at the patient's hair, I will be looking for color, quantity, and distribution of the hair. Easily plucked or very thin hair could indicate a protein deficiency. So now moving on to the patient's face. The first thing that I'll be looking for in the patient's face is symmetry and looking for any bulges, masses, or spots. I will also inspect the appearance of the skin, identifying any colors and any changes in color or pigmentation. I will now palpate around the temporal region. So in doing this, we're just going to be looking for any sunken or hollowness up here, which could indicate some muscle or fat wasting, which could be a sign of malnutrition. So now I'm going to do the same but underneath your eyes. So same thing down here, we're just going to be looking for any hollowness around the eyes or any depressed feeling right here, which could also indicate some muscle wasting or fat wasting, again indicating malnutrition. So now I'm going to examine my patient's eyes. If you could look this way for me. In doing this, I'm just looking for any spots in the eyes that could indicate some micronutrient deficiencies this way for me. Then when examining the eyes, you could also ask questions like, have you been experiencing any night blindness lately?
No.
Night blindness could indicate a vitamin A deficiency. So now I'm going to move down to the patient's oral region. This is important to inspect because you could identify some important micronutrient deficiencies. You open your mouth and stick out your tongue for me. I'll just be looking at gums, the patient's teeth, and the tongue. Okay, so now moving down to the shoulder and chest region. The first thing that I'll be looking at is the patient's clavicle bone, just lightly palpating around. A clavicle bone that protrudes excessively could also indicate some fat wasting or muscle loss that could be a sign of malnutrition. Then also taking notes of the patient's shoulder. Shoulders should be round in shape, and if you notice your patient has a square-shaped shoulder, that could indicate some muscle wasting. All right, now I'm going to ask if you could please bend your arm at 90 degrees for me. I'm just going to pinch a little underneath the tricep area. Just looking, you're going to want to separate the portion of the fat from the muscle, seeing if there's anything in between your fingers. If there were not, that can indicate some muscle or fat loss, again, a sign of malnutrition. Now I'm going to take note of my patient's skin. I'm going to be looking for color, moistness, turgor of the skin. Skin should be soft and firm when palpated. Skin that is excessively dry could indicate an essential fatty acid deficiency. Next, I'm going to be looking at my patient's nails, just lightly palpating along the nails. When you press on someone's nails, color should return momentarily, indicating good blood flow. All right, so now I'm going to ask if you could lay down for me, and I'm going to inspect your abdomen. Okay, so when doing this part of the exam, I'll be using inspection, auscultation, percussion, and palpation. So first, I'm going to inspect the patient's abdomen. I'll be looking for symmetry, rashes, bruises, and surgical sites. Then moving on to auscultation, you typically have a stethoscope where you would listen to the patient's bowel sounds in each quadrant, assessing their GI function. Now moving on to percussion, I'll place my non-dominant hand on the quadrant, hyperextend my middle finger, and then tapping with your dominant hand. I'll also be looking for any dullness or flatness and listening for some symphony. And then lastly, I'll now palpate along the 4 quadrants, feeling for any tenderness in the stomach, which could indicate some constipation. Then also taking note if the patient were to have an enlarged liver, that could indicate a protein deficiency. All right, now can you bend this leg for me? Now in this part of the exam, I'll be looking at the patient's calf muscle. When the patient's sitting like this, you should see nice and rounded and pretty firm. If the calf were just kind of plopped down, that could indicate some muscle and fat wasting as well. And then also at this part of the exam, we'll be looking at the patient's kneecap. A knee bone that is excessively protruding could indicate some muscle wasting in the quadricep region. And then the last part of the exam is just taking note of any fluid accumulation around the patient's joints. This is called edema and usually happens when the kidney isn't functioning fluids properly. In edema, you would stick your finger, and if the indentation stayed for a while, that would indicate some fluid accumulation.